In an earlier time of greater economic democracy in the United States, any resident could seek treatment at any hospital when they fell ill. Too often now, people hesitate to seek medical help even when they are really sick because they are fearful of the large bills they will receive. Since the advent of neoliberalism and the neoliberal economy, many policies have been implemented to transfer wealth upward. For example, the granting of huge tax breaks for the wealthiest while suppressing the wages of the workers, as well as privatizing many sectors of the economy, like healthcare, in order to milk large profits. Since the 1970s, when the neoliberal economy began to take hold, the cost of healthcare has continually risen. Placing profit at the center of healthcare, private equity firms began to purchase large sectors of U.S. healthcare, such as doctor practices, hospitals, hospices, and emergency rooms, and more. As costs have risen, access has often diminished. Despite soaring costs, U.S. health outcomes have precipitously declined. 3 recent consecutive years reflect reduced overall life expectancy, as well as sharply increasing infant and maternal mortality rates and increasing occurrences of diabetes and other chronic diseases. The Organization for Economic Cooperation and Development, OECD, ranks the U.S. lowest in life expectancy among 11 industrial nations, and highest in the rate of chronic disease. Reflecting effects of neoliberal commodification of healthcare and the prioritization of profits, since 1960, national healthcare spending as a percentage of U.S. gross domestic product has soared to its current outlier status, almost twice that of any other advanced nation, rising from 5% of gross domestic product in 1960 to 18% of GDP in 2020. In other words, other industrialized nations spend half as much on healthcare with better outcomes. Relating his near-death experience while seeking U.S. healthcare in 2019, Yale history professor Timothy Snyder writes in his book, Our Malady, Lessons in Liberty from a Hospital Diary, that U.S. commodification of human health prioritizes profiteering over provision of health care or prevention of disease. A white man, Snyder speculates that had he been a minority, he would not have survived his ordeal. Snyder observes that reducing U.S. health care to a privilege instead of a human right, as in most developed countries, tends to undermine democracy as well as health. Timothy Snyder spoke with Morning Joe on MSNBC.
My own personal experience with the healthcare system, I'm afraid, is like that of a lot of Americans with our healthcare system. Too many decisions are made not with the best interests of the patient in mind. We're allowed too late into hospitals. We're expelled too early. As a result of decisions like that, I nearly died. This is part of the basis for one of the reasons why so many of us have died during this pandemic. We have a system which is fundamentally not about the right of Americans to have health care, but which is fundamentally about the ability of people at the top of the system to make money. The pandemic has revealed this like so many other things.
So, Timothy, you say it was a near fatal illness that you write about in this book. And you're talking about a system here. You obviously acknowledge the greatness of our doctors and our nurses, which has been on display, particularly over the last 6 months. But what did you witness from your bed in terms of a system that needed repair, and how do we begin to do it?
Yeah, the book is divided up into lessons, and one of the lessons is actually put the doctors in charge. One of the most discouraging things about our system is that the doctors are totally disempowered. In fact, if patients realized just how disempowered the doctors are, we would really hesitate before going into the hospital. We're moving closer and closer to a world in which the doctors are basically just poster boys and girls for a medical system for profit. What I experienced was hardworking doctors, hardworking assistants, hardworking nurses, hardworking transporters who were rushed, who didn't have time, who had too much going on, who had to use a record-keeping system which is about profit rather than about information or exchange of information. What I experienced was a system in which every time a doctor or a nurse tried to do the right thing, they were pushing uphill. They always had to push uphill. And when you're pushing uphill, sometimes you don't make it, and sometimes a terrible thing happens.
To hear that a doctor can't make the decision in real time that he or she wants to make is disheartening, to put it mildly. But what are they pushing against? What's the resistance? If they know what they need to do, who's pushing back on the other side?
Young women and young men go to medical school for good reasons. They go to medical school because they want to keep people healthy and they want to keep people alive. However, when they're in hospitals, their time is managed in such a way that they have to see too many patients. And the reason for that is profit. When they're in hospitals, they face an incentive structure where they're supposed to perform procedures that can make money, and they have less time to do the things that will keep us healthy over the long run. Over the months and over the years, doctors unfortunately become discouraged. They become molded by the system. And that's one of the reasons, I think, why a centerpiece of a healthcare reform has to be one which is designed by doctors and which puts doctors back in charge. And that only makes sense when we start to think of patients as having rights, when we think of healthcare as a human right, as it is in so many other countries where people live longer than the United States.
Other countries prioritize such social protections as public health care, child care, parental leave, and unemployment coverage. All have proved sorely lacking in the U.S. during the COVID-19 virus pandemic. The increasing commodification of human health as a profit center has resulted in an overpriced and underperforming healthcare system, as U.S. healthcare has come to prioritize wealthcare over healthcare. This has been Truth Seekers Health Justice, a podcast focusing on human and environmental health and the false corporate narratives surrounding U.S. health insurance reform. This is Michelle Swenson.